Is it safe to get a dental implant after a month of tooth extraction? I met 2 dentists. One says get it done after a month. The other says after a minimum of 4 months.
Okay. So the question is it safe to get a dental implant after a month of tooth extraction? I met 2 dentists. One says to get an implant after a month. The other says after a minimum of 4 months. There is no real right or wrong answers to it. It really depends on the preference of the dentist or the implant specialist or the periodontist or the oral surgeon who's placing the implant. They are going to kind of differ on the type of practice philosophy they have. So to kind of like go back to the possible options, so whenever you have a tooth to be removed, the best and possible time that you want to put that implant in there is at the time of the extraction. As you know, that is what we do in our office. So a lot of time I'm able to remove a tooth. For example, right here, this tooth, if you look at it right here, and this is a tooth right here in the front. This patient has a lot of teeth in the front, and if it is a front tooth, a lot of times we are able to remove the tooth and put the implant in at the same time. Sometimes we were able to put the temporary crown also at the same time. So if you are able to put the implant at the same time, so realistically the answer becomes either you can go back and put the implant in a month, or you can go back and put the implant in 4 months. So it really depends on the type of the tooth and what is the status of your mouth and what is the status of the tooth that came out. And so it could be multiple factors that could be a decision maker on to decide whether immediately or maybe after a month or after 4 months or maybe sometime even longer than that. Not necessarily it's always a cookie cutter deal that you may be able to get the implant within like a month to a month 4. Sometime I've seen we have to wait for as long as about 6 to 9 months before the implant goes in for the infection or any other type of bone grafting patient may need that may need to be healing. So the question is, it could be as low as about same day, or it could be as long as like about 9 months to a year before you could receive the implant. But most of the time we are able to do the implant successfully no matter what it is. Yeah.
All right.